All right, it's the day after the start of enrollment for the Affordable Care Act. Covered California, the state's online health insurance marketplace, is reporting 5 million hits online yesterday, as well as extremely long wait times at its 2 call centers.
Sarah O'Leary is CEO and founder of Exhale Healthcare Advocates. It's a nationwide service that helps companies and individuals navigate the healthcare system. As she promised, she's back to answer the most asked questions, as well as we have some great viewer questions. Good to see you again this morning.
Great to see you both.
So with everybody going, so many people anyway, going online yesterday to sign up, we did hear that there were a lot of issues with things crashing and people not being able to complete the process. How many people actually got through, and how many problems were reported?
We can't even fathom how many people got through or didn't get through, because when the system went blank for so many people, it even happened to me, it was just so crushed. It's like a power surge. There's so many people, there's no real way to get ready for that. We just told people to be patient, it will get better. It's not a system, dysfunction, it's just so many people.
And it doesn't take effect tomorrow anyway, right?
Exactly. We have time to enroll, so don't be panicked.
There are rumors out there that if Obamacare, as it's commonly known, is defunded, that somehow you will be responsible for health insurance at higher rates. True or not? And then secondly, talk to us about some of the fraud and online scams that are going on.
First off, it's patently false that if there is any defunding happening, that somehow this is going to mean a shift in what people are already paying. Defunding, great question. Do not give any information to anyone who solicits you directly. Unless you are getting a reply phone call from Covered California, it is probably fraud. Don't give them any information. There is no outbound calling being done by the government. No official outbound calling.
Okay. Let's get to some of our viewer questions. And this is a good one because many people, I think, are in this position. A viewer asked, what if your income is zero? Do you still need insurance under Obamacare? How would you pay for it? And will they fine you?
You can log on to coveredcalifornia.com. You should have already been picked up by Medi-Cal if you have no income. But you can still go to coveredcalifornia.com and enroll through there. They will either put you into the Medi-Cal stream, which is what I suspect, or put you into the Affordable Care Act stream.
All right, question number 2 from one of our viewers. What about higher co-pays, especially with the Bronze plan?
Actually, across the board, what we're seeing is people who are going into the Affordable Care Act will pay less for their single and individual and family policies. Everyone will get a free health care checkup no matter what plan they're on, and there is a series of preventative screening tests, diabetes, breast cancer, immunizations for children, a whole host of them that you can find on healthcare.gov, all free. So there are many more things that people will get for free. But like anything, if you pick Bronze, when you get into things like hospital care, you're going to pay more.
Okay. Another viewer asks, I'm a student at a community college. We pay a small health fee every semester. As a student, I have access to student health service. Do I still need to get other coverage?
Yes. We encourage it. We recommend it. Unless you are still under your parents' plan, because of the Affordable Care Act as of last year, if you're under the age of 26 and you could be on your parents' plan and you're still on it, stay on it. Otherwise, go get on it. There are great initiatives at many of the campuses in LA, especially Cal State LA, to get these students enrolled. It's a great idea for them. The Student Center isn't enough.
Okay. Another viewer asks, is the pre-existing condition abolishment for getting health insurance already in effect?
The pre-existing condition was what kept people out from single policies. They would say, well, you're already sick, so we don't want you. The pre-existing condition as of 2014, January 1, if you are enrolled in the Affordable Care Act, is gone. So it's great news for people who have had to worry about that.
But so if you, just so I understand this correctly, if I have a pre-existing condition now, 2013, but I'm signing up for the Affordable Care Act that takes effect in 2014, I'm not in any sort of jeopardy by saying, oh, I signed up in 2013. I should sign up now.
Sign up now. Get in now.
Okay.
Another viewer asked, do you have to supply your last tax filing and Social Security card to enroll?
No, but you do have to give your Social Security number. It is how they figure out the system, because a lot of this is done on tax rebates and tax credits, and it's really our identification that the government gives us, so don't be worried about giving that out on a website that's the government's website.
Excellent. Great answers, Sarah. For more information about Exhale Healthcare Advocates. Go to ktla.com. We'll have all the information there. Covered California is the healthcare insurance marketplace by the state of California. Coming up on Friday, pediatrician Dr. Tanya Altman will join us to discuss the Affordable Care Act and how it will affect children and adult dependents. Many of them will be first-time patients. Sarah O'Leary, thanks again.
Thank you.
I want to tell people, we're calling it Obamacare. It's something that people suggest is a derisive term. The president himself has said, I don't mind if people call it Obamacare. So we try to use both Affordable Care Act and Obamacare in our coverage. Just wanted you to know that.